Hello everyone, welcome to Nursing Arena. My name is Kritika Indora and this is the second part of the questions. So, let's get started. Next question. A tracheoesophageal fistula should be suspected in a neonate immediately after birth if one of the following is present: jaundice, bile sustained vomitus, absence of sucking, excessive amount of frothy saliva in the mouth. So, the correct answer: suspected neonate immediately after birth if one of the following: excessive amount of frothy saliva in the mouth. Next question. The symptoms of severe dehydration in an adult includes all of the following except decreased thirst, dizziness, weakness, or palpitations. So, the correct answer: symptoms of severe dehydration in an adult includes all of the following except decreased thirst. Because in dehydration, the body demands more water. Next question. After thyroid surgery, thyroidectomy, patient shows carpopedal spasm. This sign indicates severe postoperative bleeding, very low thyroid hormone levels, decreased metabolism and hypothermia, hypokalemic tetany. So, the correct answer: thyroidectomy. The sign indicates hypocalcemic tetany. The next question. Which one of the following nursing intervention can be used to prevent increased intracranial pressure (ICP) in an unconscious child? Avoid activities that cause pain or crying. Lower the position of the head, Trendelenburg position. Provide environmental stimulation, or turn head side to side every hour. So, the correct answer for this is avoid activities that cause pain or crying, because that also leads to increased ICP. Next question. Lactose present in a milk is a polysaccharide, disaccharide, heteropolysaccharide, or monosaccharide. So, the correct answer: lactose present in a milk is a disaccharide. Next question. Robert Koch discovered the etiological agent of thyroids, smallpox, tuberculosis, or polio. So, Robert Koch discovered the etiological agent of tuberculosis. Next question. The vaccination was first performed by Jonas Salk, Edward Jenner, Louis Pasteur, or Alexander Fleming. So, the correct answer: the vaccination was first performed by Edward Jenner. Next question. The optimum temperature for the growth of most pathogenic bacteria is 25 degrees centigrade, 30 degrees centigrade, 37 degrees centigrade, or 42 degrees centigrade. So, the optimum temperature for the growth of most pathogenic bacteria is 37 degrees centigrade. Next question. While monitoring an unconscious child admitted with a history of fall, nurses notices that the child suddenly has a fixed and dilated pupil. This indicates eye trauma, neurosurgical emergency, increased parasympathetic activity, or indication of brain death. So, the correct answer is this indicates that there is a neurosurgical emergency because fixed and dilated pupil has an incidence of brain trauma. That means there is an injury in the brain. Next question. Inoculating loop is sterilizing by hot air oven, autoclave, flaming, or radiation. The correct answer is flaming. Next question. All of the following precautions are true while recording oral temperature of a patient except measurement of temperature should be done on a fixed time of the day. It is measured at least 3 minutes after keeping the thermometer sublingually with the lips closed. Not to record in a patient who have recently smoked. In patient on oxygen inhalation, stop the oxygenation before recording oral temperature. So, the exception in this question is, in patient on oxygenation, inhalation stop the oxygenation before recording oral temperature. It can lead to more complexity and complications and may lead to death also. That's why we don't have to stop the oxygenation in the patient. Next question. Which one of the disease is not caused by an acid-fast bacilli? AFB. Leprosy, tuberculosis, nocardiosis, or typhoid? The correct answer, the disease is not caused by an acid-fast bacilli, is typhoid. The next question. A person seeing design on the floor thought it was fossil. It is an example of illusion, yellow fever, herpes, or rabies. So, the correct answer, if person see a design on the floor and thought it was a fossil, it is an example of illusion. Illusion is the false misinterpretation of anything in the presence of the stimuli. Next question. In case of delay in transportation of cerebrospinal sample, it should be kept at room temperature, refrigerated at 4 degrees centigrade, kept at minus 20 degrees centigrade, kept in ice bucket. So, the correct answer, in case of delay in transportation, the CSF sample should be kept at room temperature. Next question. Which of the following disease is produced by dog bite? Influenza, yellow fever, herpes, or rabies? The correct answer, the following disease is produced by dog bite is rabies. Next question. Vidal test is used for the diagnosis of enteric fever, malaria, cholera, or plague. So, the correct answer, Vidal test is used for the diagnosis of enteric fever. Next question. All of the following are precautions in the care of a patient with high fever except never leave a patient with high fever alone. Rigors and convulsions may occur at any time. Administer antipyretic drugs. Tepid cold sponging is not useful in patient not responding to antipyretics. So, the correct answer for this is tepid cold sponging is not useful in patient not responding to antipyretics. Next question. All of the following instructions are given to a patient before complete tomography CT scan, except wear comfortable, loose-fitting clothing, remove all metallic objects such as hairpin, denture, jewelry, etc. It will not affect the outcome of pregnancy in case of female patient, or kneel orally several hours before the scan. So, the exception is it will not affect the outcome of pregnancy in case of female patient. Next question. The nursing care of a patient with dengue fever includes all of the following except provide cold compression, provide proper hydration and electrolyte balance. Symptomatic treatment is given irrespective of the grade of the disease. Low-grade dengue fever can be treated at home. Next question. The nursing care of a patient with dengue fever includes all of the following except provide cold compression, provide proper hydration and electrolyte balance. Symptomatic treatment is given irrespective of the grade of the disease. Low-grade dengue fever can be treated at home. So, the correct answer provide cold compression. This is the exception. Next question. Which one of the following is a non-modifiable risk factor for the atherosclerosis? Cigarette smoking, hyperlipidemia, female over 55 years of age, or sedentary lifestyle. So, the non-modifiable risk factor for atherosclerosis is female over 55 years of age, because age cannot be a non-modifiable risk factor. We cannot modify it. Next question. Doctor advised the nurse to prepare the room for a patient with a spinal cord injury at C7 level. Which one of the following is most essential to be kept ready for this patient? The halo brace device, a catheterization tray, a ventilator on standby, or the spinal kinetic bed? The correct answer for this is a ventilator on standby. Next question. A hypertensive has been admitted in a ward for observation. He mentions the attending nurse about squeezing pain in the chest even at rest. Which of the following action is necessary for this patient? Give ibuprofen tablet to reduce pain. Advise the patient to move out for fresh air. Rest of the patient and call the attending doctor, or inform the patient that he is fine, nothing to worry. So, the necessary action for this patient is rest of the patient and call the attending doctor. Next question. A patient just returned from the post-anesthesia care unit PACU after hemorrhagectomy. His operative order includes sitz bath, is necessary to relieve tension, promote healing, lower body temperature, or reduce pain. So, the correct answer is promote healing. Sitz bath is necessary to promote healing. Next question. All of the following are signs of anemia in a patient except yellowness of the skin, tachycardia, dyspnea on exertion, or lethargy. So, the correct answer, the signs and symptoms of anemic patients are all except yellowness of the skin. Next question. A 36 years old female complained of headache and neck pain. Examination by a nurse reveals painful flexion of the neck to the chest, natural rigidity. This could be due to brain tumor, meningitis, cerebrovascular accident, or subdural hematoma. So, the right answer is meningitis. Meningitis is the inflammation of the meninges, which is the layer of the brain. And this is the cardinal sign of the meningitis, natural rigidity. Thank you class for listening this.